Well, my name is Kelley Gilliland, and a little over a year ago, I had a very serious scoliosis surgery. It was a 2-day surgery. The first day I think was June 26th, and the second was June 27th. I have very little memory from back then. I mainly remember waking up and the recovery part of it. But it's very serious 2-day surgery, and I had scoliosis. I had a type of scoliosis that they call kyphoscoliosis. So I not only had a curve in the middle of my back, but I also have a hump towards the top of my back. And so Dr. Patel was trying to fix both of those things as best as he could to get me straight up and down. I was very curved to the right and having a lot of problems with that.
And what was your day-to-day life like prior to your surgery?
I'm kind of jumping ahead a little bit, but I had a previous back surgery. I had a fusion at L5-S1, so way down at the bottom of my spine, I had a fusion. And my orthopedic surgeon at that time told me he was just buying me some time. He said that right where that fusion was, right above that was my scoliosis. And he felt that, this was going to hold it for a little while, but the scoliosis was going to cause me trouble pretty soon. And he said, the next time I can't help you, we're going to have to find a better route for you, somebody that can do a very extensive surgery. So I went along for about 3.5 years, just fine. And then I started having tremendous pain down both my legs. I was very slanted to my right. And I had pretty much everything was painful. Walking, sitting, standing for a long period of time. The only thing I could do to not be in pain was to lay on my stomach. So I would work and come home and basically just be on my stomach. So for 6 months, while I waited for Dr. Patel's schedule to clear out, my life was pretty limited.
And what was the pain level? Like, what would you say on a scale of 1 to 10?
It was off the charts. I would wake up in the morning, and for about an hour while my spine was shifting itself to the right, I could kind of get around. I could take a shower and get dressed and all, but that was diminishing too. I was just in such severe pain, and the medicines that I was giving they didn't help me at all. They either didn't hit the pain, or they made me feel sick to my stomach or like a zombie, and I have to work. So none of those things were working for me at all. So I basically just dealt with it and waited.
Ouch. And then tell us about, once you woke up, what was your experience like in the hospital and with the team of recovery folks and the surgeons and the PAs and everybody else?
Well, that part I really don't have any memory of in the hospital. I know my husband said mine was a 2-day surgery. The first day, Dr. Patel went in and cleared out the first surgery, the first fusion, and then got the area ready for day 2. And so that night, I don't remember a thing. But my husband said I was talking, so, but I don't remember anything about that. And then the next day, I don't remember at all. And then waking up from the surgery, I really don't remember at all either, except being very thirsty. And that's about all I can remember. I know that I was released from the hospital, and we came home. And then I had a bit of pain in my hip, and I thought maybe something was wrong. So we came back to the hospital, and they did, I think 2 days after my surgery, and they did some more x-rays, and everything was fine. So I was just waiting for my hip to calm down. And then I was just basically at home recovering. And the recovery was quite a while. It does take a lot.
And then what's your pain levels now?
None. I have no
0.
pain whatsoever. I'm straight up and down. I'm a success story. I think Dr. Patel is the best. I, it took probably a good 6 months after the surgery to start feeling a little bit normal. And, like I could do pretty much anything, but I can, and I am now. It's just nothing short of a miracle.
Sorry, what type of activities can you enjoy now that you couldn't enjoy before?
Everything.
Anything specific?
Well, I'm going to get a puppy, which I never would have been able to do that. And I'm very excited. So I have a little puppy coming in a few weeks. And but now I can do everything that I wasn't able to do. I can walk and hike, and I can sit at work if I'd like to. My work I have a desk that goes up and down, and I can actually use the up and down now. And I'm just so much more comfortable. I'm happy again. Being in that amount of pain for a long time does a lot to your psyche. And, I was pretty down.
That's
but not
awesome.
anymore.
Yeah, this is great.
Yes.
It's exciting to be able to hear these stories and learn about it. Is there any message that you would give to future patients that you wanted to tell them about the process, or anything you would suggest?
Well, I think that they are in great hands with Dr. Patel, and I would trust whatever he said or recommended. He is nothing short of the best. I mean, he really did do an amazing job on my back. And, I would just say to trust him and trust that he knows what he's telling you to do. He was, and when I came back for aftercare, 3 months and 6 months and then a year, we were checking on, different things like my cast that I wore for a while and all. And he was very involved in all of that and the aftercare and making sure that I wasn't wearing the brace too long or wearing it long enough. So he stays involved to the very end.
Good. Yeah.